was diagnosed with CF at 6 months old and lived a relatively normal childhood up until about 12, and that's when I started getting IV therapy in the hospital and things like that. And then by the time I was in my early 20s, I was in college, but I was really struggling with my health, and eventually I was just not able to keep up with my college life, and so I dropped out of school and went to the doctors, obviously, and they put me on the double lung transplant list at that time. And so I waited 5 years for my first set of donor lungs and did well after the transplant for about 2 years. And then unfortunately I got chronic rejection. And so 4 years after my first transplant, I had a second transplant. And that one, knock on wood, has gone extremely well. I've had no problems, no complications for 4+ years now, and am enjoying really the best health of my life. And so when I woke up in ICU after my second transplant, I was intubated, I was on a lot of drugs, morphine, things like that. But even still, I was still conducting traffic. I was still telling nurses, that's not the right med, and you need to come back later, and leave me alone, and all the stuff that as a patient, as a CF patient, becomes second nature, because you have to be an advocate for yourself as someone with a chronic illness in a very complicated and sometimes broken system. The only way to survive is to be able to advocate for yourself. So because that had become second nature, I was still doing it in the midst of morphine and intubation, and it dawned on me really in that moment, wow, I've been doing this patient thing for a long time, and what must this be like for people who haven't been doing it for 3 decades, and all of a sudden they're hit with an illness. They come into this system naive, thinking that they can lay back and relax and not have to worry about anything. And I thought, I want to use all this stuff that I've learned and try to help people who enter what I call the illness maze, the medical maze, and help them try to navigate it and maybe, go around some obstacles that most of us have to go through the hard way. So I started doing that by giving talks. I volunteered as a hospice respite caregiver, and I wrote a book, Sick Girl Speaks, which I hope is more of a handbook on patient advocacy as well as emotionally coping with illness. And along the way, so I started working with patients and families and empowering patients and families to take care of themselves. But along the way, I've discovered that there's a real deep desire and need among the medical community to understand what it is to be a patient. And so now, alongside teaching patients and families, I also teach medical professionals, medical students, nursing students, social work students, anybody who has their hands on a patient. I get to come in, and I call myself an illness ambassador. I get to come in and say, this is what it feels like to be given a diagnosis. This is what it feels like to not be respected as a human being. This is what it feels like to live your life with a chronic illness. And so that has been so fulfilling for me. I like to say that I'm bringing the CF community to the medical community and saying, this is what it's like to live like this. And I can't tell you how overwhelming the response has been. I think our medical culture is changing. I think that people are now ready to coincide medicine and emotion. They're finally getting to the point where they realize that taking care of a patient's well-being emotionally is equally important to taking care of a patient's well-being physically. And so I hope that by coming in and speaking to them about the emotional journey of illness and what they can offer, I tell them to offer respect, peace, empowerment. Those are the 3 things I ask medical professionals to provide to their patients. And I hope that by doing that, we will continue to change this culture of healthcare so that we elevate it to a level beyond what we've seen and what I've seen in my lifetime. So it's been immensely fulfilling. I couldn't be happier with my life. I feel like the luckiest human being in the world, really. My website is www.sickgirlspeaks.com, just like the title of my book. And basically there, obviously, you'll learn more about me, more about what I'm doing as far as my speaking engagements, things like that. I also do personal coaching for, I call it illness and transition coaching. So for people who are going through a difficult time, struggling with their illness, struggling to figure out who am I beyond this illness, how do I not allow CF or cancer or whatever the illness might be, how do I not let that become my identity? That's a lot of the work that we do. I do a lot of work with people post-transplant who are having a hard time with that transition, and work with them on how to get back to a place of stability and gratitude and all of those kinds of things. So that's on my website as well. My schedule is on my website. Obviously, my contact information, happy to hear from anybody who has any questions or wants to talk to me about anything. And you can also buy the book off of my website. If you buy the book off my website, it'll be autographed. So that's a little different than if you buy it off of Amazon.com. So, yeah.
Thank you, Tiffany.